Perfect. We are live now. Hola a todos, todas. Este webinario va a ser en idioma español e inglés, entonces les invitamos a que puedan seleccionar. Hay interpretación disponible en inglés, español, francés y portugués. Les invitamos a seleccionar el canal o la opción que mejor les convenga para que puedan disfrutar de la mejor forma de este espacio. Hi everyone, this webinar is going to be on Spanish and English. We have interpretation available on English, Spanish, French, and Portuguese. So we invite you to choose the better option fit with you to enjoy this amazing space. We're going to start in 2 minutes. We're just waiting for everyone to come, and then we're going to start. Para todas las colegas que están apenas ingresando, contamos con interpretación. El webinario será en inglés y en español, entonces les invitamos a elegir la mejor opción que se ajuste a ustedes. Contamos con interpretación en portugués, inglés, francés y español. Y pues bueno, esperamos que puedan disfrutar mucho de este espacio. Perfecto, iniciamos. Hi everyone, thank you everyone for coming today with us, for joining us for this amazing webinar. Today we're going to be talking about digital health, and especially about digital health interventions to deliver sexual and reproductive health and rights for young people. We are so happy to have you all here with us. This is a very important moment for Fòs Feminista, but also for the Center for Comprehensive Sexuality Education and Youth-Friendly Services and our college from Data Pop Alliance, who have been working with us during the last year to have the amazing resources that we will be presenting today. So in this webinar, we're going to be sharing about the conceptualization or general concepts that we use in Fòs Feminista to talk and understand digital health, also digital health interventions. We will also have a conversation with some partners from Colombia and Kenya about what is their experience using digital health interventions to deliver sexual and reproductive health care for young people. And finally, we will have the official launching of a set of recommendations to improve and develop digital health interventions to deliver sexual and reproductive health and rights for young people. We hope you enjoyed this space, and we will be happy and very attentive to all the questions and all the comments that you have in the chat. Please remember to choose interpretation. We have interpretation in Spanish, English, French, and Portuguese, and we hope this space to be fruitful for you. So now I'm going to hand over to my colleague, Anthony from Data Pop Alliance, to start with a little ice break. Anthony?
Yes, hello everyone. So we're going to start with some icebreaker questions, which I believe you can answer in the chat, and we will read some of those. So the first question we have is, in one word, how would you describe the biggest barrier youth face today when trying to access sexual and reproductive health services online? So go ahead and think about that, and if you could send some answers in the chat. Again, just one word to describe the biggest barrier that youth face whenever they're accessing these services online. And we'll think about that and read a few of those. All right, so we have some great answers coming in. I'm seeing misinformation. That is definitely something that's encountered. Information. Accessibility, stigma, also very true. Reliability, taboos, shame, not knowing what's reliable. So it sounds like we're getting a lot of those answers that have to do with what we're going to talk about. So yes, it sounds like we have a lot on shame, or maybe feeling embarrassed or not really being comfortable with the information, also getting the right information. That's really important. Lack of information, and also reliability. So access and how to get that information. But it sounds like we have a lot of focus on the actual quality of the information and also being comfortable getting that information. Thank you all so much. We'll move on to the next question. If you could design a digital tool that supports youth sexual and reproductive health, what would be the must-have feature? So if you were designing this tool, a digital tool, what would the must-have feature that you would want to include? Go ahead and answer in the chat, and we'll read a few of those as well. Okay, we have anonymous access. Yes, that sounds great. Data protection, no cost. Yes, so accessible, no cost. A map of service providers. That's a great answer. Confidentiality, if possible. Anonymity. AI chatbot. Okay, great. Cultural sensitivity. Very important. Very important. List of services. Usable offline. That's a great one. Accessible in many languages. Human connection, so reliable providers. Great. All right. So yeah, it sounds like we have a lot of answers around also trying to increase accessibility for as many users as possible. Those are great answers from everyone. Thank you so much for those. So all of these are going to be things that we're going to be talking about today. It sounds like everyone is on the right track for the information we're going to provide. So yes, we'll move on to the next section now.
Great.
Gracias, Anthony. Wow, es bastante interesante ver todas las diferentes comentarios que todas hicieron. Como ya Anthony lo mencionó, son cosas de las que vamos a estar hablando, pero también creo que es muy interesante ver desde la perspectiva desde cada una de ustedes que están asistiendo el día de hoy. Tenemos con nosotros tanto a personas que trabajan con organizaciones que se dedican a la prestación de servicios, como también de personas jóvenes usuarias o incluso de personas que se dedican a proveer financiamiento para estas intervenciones de salud digital. Entonces es bastante interesante ver desde qué perspectiva está cada persona compartiendo esto. Y pues bueno, ya estaremos hablando más adelante sobre ello. A continuación, le voy a ceder la palabra a mi colega Katrina Wicks, que estará compartiéndonos un poco sobre los conceptos generales sobre salud digital. Adelante, Katrina.
Thank you very much. Hi, everyone. And thank you for providing that really helpful feedback about your experiences and insights about digital health. Your feedback really highlighted, as my colleagues mentioned, some of the very challenges that we hope today's webinar can address, and also highlight some of the key features that we aim to work towards together. So to kick things off, I'm Katrina Weeks. I am the Associate Director of Business Intelligence Evaluation and Research at Fòs Feminista, an international intersectional feminist alliance that works in solidarity with over 100 partners in the Global South to advance sexual and reproductive health, rights, and justice, as many of you are already aware. But now, before we dive into the presentation on findings from our project on digital health with the DataPop Alliance and some key recommendations generated from this work, as well as our panel discussion with our partners from the Fòs Feminista Alliance, all of which will provide really important insights related to digital health for youth. We wanted to begin this session by setting the stage with some key context on digital health in order to ground our conversation. So to do this, we are kicking things off by dispelling some of the commonly held misconceptions about digital health interventions, so that we can have a shared understanding of this concept, and also so that we have a common language for this webinar. So let's start with a common myth here. So some people believe that digital health interventions are not based in evidence, and that any use of digital technology always benefits people. Now, what we see in reality is that this isn't necessarily the case. Digital health isn't about just applying any haphazard, unsubstantiated idea that doesn't have evidence to support its implementation. Instead, digital health interventions are defined as evidence-based interventions to enhance health, rights, and justice that are implemented through information and communication technologies. So it's really about implementing interventions that we already know work using digital technologies. And that's really a key definition that we work with within the Fòs Feminista Alliance. As an alliance, we have decades of experience designing, implementing, and evaluating strategies for improving sexual and reproductive health, rights, and justice. So when we refer to digital health interventions, we are referring to those interventions of demonstrated efficacy and effectiveness that are being applied through digital technologies. Now, it's also important to acknowledge that the definition that we're using here of digital health interventions is quite broad, and our definition includes digital deployments that achieve objectives related to health and rights and justice. And that's because we recognize that all of these areas are very interconnected and essential. So this can include things like evidence-based approaches, such as sexual reproductive healthcare and services, advocacy, comprehensive sexuality education, mass communications, and other tactics that are deployed via digital devices. And then just lastly, as one other definition, when we refer to digital sexual and reproductive health interventions, we're specifically referring to those interventions that enhance sexual and reproductive health, rights, and justice. So I also just want to mention that I have mentioned a couple times here digital technologies and information and communication technologies, also referred to as ICTs, really are all the same thing. They refer to a diverse set of tools and resources that collect, collate, store, communicate, or exchange information through electronic means. And this can be achieved through the use of digital devices like computers, basic phones, smartphones, radio, wearable devices like heart rate monitors or smartwatches, and cloud computing servers, just to name a few. There are really a lot of them. So now getting back to some more common myths, another misconception that we see often in the digital health field is this understanding that digital health only refers to telemedicine and they're the same thing. Now, that's not actually the case. Digital health is actually a very broad field. It is really the umbrella term that refers to all of the ways in which digital technologies are used to support health, rights, and justice. And these unique functions of digital health interventions are listed here on the right side of the screen. As you can see, it's really broad. There are a lot of different focus areas of this work in digital health. And this is based on the World Health Organization's classifications of digital health interventions, as the Fòs Feminista Alliance aligns with the different definitions and taxonomies for digital health from the WHO. Now, within this broad domain of digital health lies the sub-area of telehealth. And telehealth refers to the delivery of services between a trained care provider and a person through a two-way communication using a digital device in a manner that allows for the identification and management of a person's health needs. So a trained care provider includes counselors, nurses, activists, physicians, volunteers, and others. And also, it's important to note that telehealth can be conducted in real time or it can be asynchronous, and it also can involve video, imaging, or other home-based devices to enable the transmission of health information to guide both diagnosis and decision-making. Meanwhile, you see within telehealth that telemedicine is a subset. Telehealth includes a wider scope of services beyond just clinical services, such as counseling, case management, psychosocial support, legal support, and other care that's not always reflected within the more narrow realm of telemedicine. So as an alliance of feminist organizations, we typically use the term telehealth over telemedicine, although they're pretty similar. And this is just because integrated and comprehensive care that includes counseling and other services is central to our holistic, person-centered sexual and reproductive health care approach. So speaking of telehealth, one common misconception is that any digital health service refers to any interaction where information on health and rights is given to a person over digital technologies. However, this isn't always the case. Across the Fòs Feminista Alliance, there are minimum standards for digital health services, which apply to all people, including young people. So they are listed here. First, digital health services involve that two-way exchange that I just mentioned earlier when I was talking about telehealth, in which a person shares information on their individual needs and a care provider asks questions and provides personalized, accurate information to them. Now, if information is only exchanged in one direction and it's not personalized to the individual, then it's not a care service. Instead, it might be an information, education, or communication intervention, which provide more general information that's not tailored to the individual. Now, for the provision of digital health services, the care provider must be appropriately trained for the type of services they are providing, and it must take place in a confidential manner so that piece around being anonymous that you all mentioned earlier, that's very applicable here, so that no one else can access any personal information that is exchanged in this interaction. And this is particularly for unauthorized actors. And this exchange should also adhere to guidelines, particularly for young people and for other individuals who might be in situations of vulnerability. And finally, these services should be centered on decision-making by the person, enabling the management of their health needs. So when we're talking about digital health services of any kind during the remainder of this webinar, we are referring to the services that meet all of these key criteria. So now we have another common misconception here, which is that digital health interventions it doesn't really matter for them what platform or software is used. But this honestly couldn't be farther from the truth. It's actually very important to utilize secure platforms that uphold a person's privacy and confidentiality for certain digital health functions. And this is important because it does distinguish between the different types of digital health functions. So similar to the ethical principles guiding all interventions to enhance health, rights, and justice, digital interventions really should only be implemented if they do not harm. And for the exchange of any personal information, which is the really key part here, through a digital technology, which, as I just explained, is always involved in any digital healthcare service, there must be adequate security and privacy protections so that this private, personal, and protected information cannot be used by unauthorized actors. So just to give an example, this includes ensuring that digital platforms that sell their data to any buyer or who do not keep the information exchange on them private, as is the case with many social media platforms like Facebook or Instagram, should not be used for the exchange of personal information. And also, it's important to really acknowledge the consequences of not protecting privacy and security. So if privacy is not ensured for these types of activities that involve the exchange of personal information, the digital deployment can really put people at risk for harm, including the risk of violence, fraud, identity theft, criminalization, or discrimination based on their identities, health conditions, or service history, among a lot of other potential harms. So this is why digital services and also other interventions that involve the exchange of personal information must have robust security, privacy, and confidentiality guarantees and protections. And this is really considered a must-pass component in order to provide services through digital technologies. And so we wanted to share that before we really start discussing in greater depth digital health services. And finally, there's also the misconception that's really widespread that the fancier, more cutting edge technology, the one that's more exciting and new, is always better. And this really isn't the case. A lot of times, simpler technology is better, particularly in some contexts in the Global South. And focusing only on fancy, exciting technology can lead us astray. And this is because hype around high-tech platforms and what some call shiny new objects does not automatically translate into health impact. Actually, what we see is that this hype cycle has led to the implementations of thousands and thousands of uncoordinated and unsustained digital deployments, which often don't last longer than a few years once that initial excitement wanes. And ultimately, they end up failing to achieve scale and long-term positive impact. So in reality, successful digital deployments are actually about implementing digitally enabled, evidence-informed interventions successfully with and for the population it aims to reach. And this might sound pretty straightforward for most of you, to be honest, but it is actually a pretty common misstep. And that's why the following presentation and the discussion we'll be sharing with insights about effectively implementing digital health interventions is being shared. It's so that we can co-create even more successful strategies for implementing these approaches to enhancing sexual health, rights, and justice. And just also generally also enhancing overall health, rights, and justice. And specifically, we will be sharing key findings and recommendations on digital interventions with young people. And also our partners will be sharing some really important examples of their digital health interventions and lessons from their experiences. So with that introduction, thank you all, and I will pass it over to my colleagues from the Data Pop Alliance.
Thank you, Katrina. That was really insightful, and actually, it really provides a basis for what I'm gonna share over the next 10 minutes. Thank you, Tony, for sharing the screen. So, hola a todos. Hi, my name is Ivette Yáñez. I'm a senior researcher at Data Pop Alliance, and I had the pleasure of working on this project. I'm also the director of strategic communications, but specifically here, I was able to be part of the research team, and it was such a rewarding experience, both because of the important scope and approach, but also because it was a beautiful collaboration with Fòs Feminista. And so, yes, Tony, if you can go into the next one, thank you. Today, I'll be giving you a brief overview of our joint project with Fòs. And I know the title of the project that you see right here is a bit long, but really during my presentation, I hope that the meaning and the goals of this project become clearer and easier to grasp. So, to start a little bit of background, in late 2023, our data feminism team, which is an important and central program in our organization, was selected by Fòs Feminista to lead this or to work with them in this initiative. They approached us because they identified an important gap, and that was basically there wasn't enough evidence or analysis on what youth-friendly approaches of digital health interventions, or DHIs, as I will refer to them, were actually using to deliver sexual and reproductive health services to young people. They knew that a lot of organizations were already targeting youth and adolescents through app, hotlines, web platforms, and other digital technologies, but there wasn't enough analysis on what the strategies they were using or how well they were working. So over the 9 months that this project lasted, we tapped into Fòs Feminista's network, which is really expansive. It's about 100 organizations across Latin America and the Caribbean, Southeast Asia, and Africa. And we really try to understand what methods were being used out there to assess them critically and to turn those insights into actionable recommendations for youth-friendly approaches. Something important to mention here is that while the work was commissioned by Fòs Feminista and based on their partners' work, we really designed the outcomes so that any organization working towards similar goals can benefit from these findings. So, how did we go about carrying the project? First, we carried out a systematic literature review. We analyzed 75 articles, so it was very comprehensive. I don't have time to go into too much detail here, but one of the big takeaways was that there was no real consistency into how effectiveness is defined or measured when it comes to youth-centered DHIs. Then we had the second step, and we supported FOS in designing a self-assessment survey targeted to their partner organizations. And the goal with this survey is really to help them understand in much more detail how DHIs perform across 3 critical dimensions. And I'm going to talk about those dimensions in a second. But when partners are able to complete these surveys, they can self-reflect on their current practices, on existing gaps, and highlight areas of improvement. And more importantly, this survey serves as a practical tool, not just for evaluation, but for building a stronger, more inclusive youth-centered strategies. Finally, we developed 5 case studies across 5 countries using qualitative methods, and I'll tell you more about that in the next slide. Thank you, Tony. So as I mentioned earlier, as I just mentioned, we conducted 5 case studies with organizations based in 5 countries. The countries you see here in the slide. The first 3, as you can see, are in Latin America, where Fòs Feminista's network is the strongest. But we'll also talk to an organization in Kenya and another one in India. Of course, they are developing DHIs in their context. Of course, we don't claim this is a representative sample per se, but the case studies were selected very carefully and really help us to capture a wide variety of digital strategies for delivering sexual and reproductive health services for youth. They also reflect just how much cultural and technological context vary between countries, because that means that organizations were adopting very different digital strategies and youth-friendly approaches depending on where they were working, right, and the audiences they were trying to reach. So for these case studies, what we did was that we carried several interviews with the staff from these organizations, and you'll actually hear from 2 representatives of these organizations later in this webinar. They'll share first-hand insights about their work and their experiences. But before that, let me tell you that using what we learned from the interviews, which, by the way, were guided by a questionnaire that was created based on the indicators that we found on the lead review, we were able to identify 3 consistent priority areas that help successful DHIs really engage youth. And these are the ones you see right here: digital maturity, intersectionality, and youth friendliness. I'm gonna walk you through these areas in just a moment, but just bear in mind that I'm gonna give you a sort of a high-level overview of this, because later during this webinar, my colleague Anna, who by the way led this project on the PA side, she's really gonna dive into specific recommendations developed or based on each of these priority areas. Okay, so digital maturity. When we talk about digital maturity in very simple terms, it's about how well digital health initiatives are able to navigate, leverage, and adapt to the digital environment they are working in. So it is important to be very contextual in terms of what's available for you, right? To better serve the people and their needs in terms of sexual and reproductive health and rights. So when we look across the case studies, I'm not going to go into all what we saw, lesson, please take a look in the slide. But I think the key insight here really was as most successful interventions adopted hybrid models, mixing digital delivery, so taking advantage of the digital tools they had, but also being very mindful of other aspects and features that were not necessarily digital, right? Or that use technologies, such as, for example, we identify a WhatsApp helpline that increased effectiveness by pairing their work with a peer educator support system that could actually go with these girls that were requesting the service and provide much more in-person support whenever it was needed, not necessarily all the time, but when it was needed. And by the way, another key insight that maybe for time we didn't have to add necessarily, but it reminds me of what Katrina was saying a moment ago, and it's part of this area, is that innovation is not necessarily, at least in this area, it's not about like selecting the most shiny object of digital technology. It was really about being very mindful of the infrastructure and the user behaviors and their preference in the local digital ecosystem they were based in. The next slide, please. Thank you. The second area is intersectionality. I think many of us are familiar with this term, but when we talk about it in the landscape of DHIs, we specifically are talking about recognizing and integrating in very practical ways the fact that young people are not a singular uniform group, right? Their experience and it vary a lot depending on aspects like gender, race, class, disability, where they live, whether they are migrants or displaced. And what we notice is that when, like the key insight we were able to find across the case studies was that when DHIs were collaborating with grassroots or identity-based organizations, they were, this really enhanced the relevance and the reach they had, specifically in targeting youth audiences. One case study that highlighted this type of outreach strategies that were very intersectional was another helpline that was posting their information, their contact information along migrant routes, ensuring that the young girls that were trying to access the services, in this case medicated abortion, were able to access these services in a time where they needed the most, and in some cases, right, where they are at risk of needing this, and where it might be the hardest. Yeah, so this of course, this strategy comes from a very intersectional mindset in terms of planning, in terms of designing, etc. The next one, thank you. Okay, so the last priority area is youth friendliness, of course. And this is very, very important because it really helps DHIs, the staff and the people behind these digital health interventions to create interventions that are safe, inclusive, and empowering for young people. The goal is for them to feel comfortable, that they have no fear, that they have no judgment, they have no fear of a stigma, right? And basically that they feel safe in using this type of services. So across the case studies, the key insight that emerged in this area was that DHIs that were integrating the feedback of young people at every step, right, from the design to the implementation of the DHIs, they were integrating the feedback, the points of view, the voices, or even sometimes actual young people being the leaders of these interventions, right? One clear example that we found here is that through our fieldwork was that some of these initiatives were held in participatory consultation with youth before finalizing their platforms or whatever digital or technology approach they were using, and they were using those inputs to make the interventions more relatable, more accessible, and more youth-friendly in very specific ways, right? And I don't want to go into the details of exactly how, like, for example, language is a big one because, as I said, my colleague Anna will go into those details a little bit later in the presentation. But I think this framework will really provide a basis for you to comprehend better. And I know for you, maybe you are just hearing this in another language or that you are used to because you already, some of you already understand this perfectly, but we're trying to put this a framework and a language to understand better and to be able to share this with other organizations and help them really engage young people in the best possible way. So thank you everyone, and I'll give the word back to the team in Fòs Feminista.
Muchas gracias, Ivette, por esta presentación. Y bueno, como ya les compartí, Ivette, este proyecto ha sido bastante importante para nosotras, no solo en Fòs Feminista, no solo porque nos ayudó a hacer un mapeo de todas estas intervenciones digitales de salud que las organizaciones que forman parte de nuestra alianza están implementando a lo largo del mundo, sino también analizar cómo estos procesos o estas experiencias de implementación en diferentes países del mundo tienen ciertas peculiaridades que en ocasiones tienden a, digamos, ser parte del éxito de estas implementaciones, como son estos 3 dominios que Ivette nos compartía. Y bueno, antes de pasar con estas importantes recomendaciones que se generaron a través del análisis de este mapeo de intervenciones, vamos a tener una pequeña conversación con un par de colegas de organizaciones que forman parte de la Alianza de Fòs Feminista y quienes tienen muchísima experiencia trabajando en la implementación de intervenciones digitales de salud. Entonces voy a invitar a mis colegas Nicolás Rodríguez de la Fundación Unimedicos y a mi colega Mickreen Adhiambo de TICAH en Kenia. Hi Mickreen, hi Nicolás.
Hola, muy buenos días.
Perfecto. Bueno, pues en esta parte vamos a tener una pequeña conversación en la cual queremos escuchar un poco sobre las experiencias que ustedes han tenido desde las instituciones en las que trabajan. Sabemos, desde Fòs Feminista sabemos que TICAH, por ejemplo, es una organización sumamente reconocida en Kenia que trabaja para la prestación de servicios y que aparte trabaja bajo una perspectiva interseccional que específicamente se enfoca a que mujeres, niñas y personas de género diverso accedan a sus derechos y salud sexual y reproductiva. De igual forma, en el caso de la Fundación Unimedicos en Colombia, sabemos también que es una de las organizaciones líderes en el país que se dedica a, digamos, apoyar o alcanzar esta realidad de que todas las personas en Colombia tengan acceso a la salud sexual y reproductiva e incluso algunas otras personas que se encuentran en tránsito en el país. Nos gustaría saber un poco sobre, bueno, más bien me gustaría preguntarles, Nicolás y Mickreen, si pueden compartirnos un poco cómo ha sido su experiencia en la implementación de intervenciones de salud digital. Si quieren, podemos comenzar contigo, Mickreen. Can you share us about your experience working with digital health interventions?
Thank you so much, Ruben, and a very good evening. Once again, my name is Mickreen Adhiambo from an organization called TICAH, which is the Trust for Indigenous Culture and Health. And I support with programs under community outreach and hotline management. And in this case, we're going to have the conversation around the hotline as a DHI. And just to give a background on how the hotline was formed, it was from conversations with the communities that we work with. Most of our programs are within informal settlements, working with persons living with HIV, persons with disability, young people, teenage mothers. And from those conversations that we were having, the issue around accessing information on contraception, information on safe abortion, information on GBV response came out as a huge challenge. And many of these community members were like, these are things that are coming up. And this was in the wake of our new constitution back in back in 2010, because the issues to do with access to safe abortion was it was so emotive and it was a non-public conversation. So having these conversations where women and girls and gender diverse people we were working with were surviving violence and could not have access to contraception, to safe and legal abortion, and basically comprehensive SRHR, the question became, what can we do as an SRHR serving organization? And from then we set up a hotline. Those days, they were just like mobile phones that we could work with. The counselors those days would just work with mobile phones. And of course, talking about security, because the information that was being provided for was not too much to be publicized. So the mobile phones back then were the only devices that could provide information. And at that time, it was prepaid. Community members would pay for access to information. But now, as time went by, the hotline kept on improving and being updated to a point that we are currently hosting a toll-free hotline. And in this case, where young people and general public could have information and access to the hotline without the need to worry about data, without the need to worry about the airtime. So this has really made it possible for people, even in the hard-to-reach areas. And when you're talking about the hard-to-reach areas, it includes the arid and the semi-arid areas in Kenya, the informal settlements, the rural areas in Kenya. It enables everyone in their demographics to have access to the hotline through making calls and even through the WhatsApp platforms and our digital platforms. And in this case, our digital platforms include Facebook, Instagram, TikTok, WhatsApp, Telegram, because those are the platforms in the context of young people. Those are the platforms that the young people associate with. The young people have more engagements with. So the hotline in itself is the backstop where all the information is accessed, because one of the things that happens with our digital spaces is censorship, more so on conversations around comprehensive sexuality education and access to safe and legal abortion. Most information is censored, but we figured out a way to have it in a local dialect, and there's something that is called slang. Slang is a mixture whereby we are using English, Swahili, and the language that the young people are able to understand to get information from the digital platforms that we host. And then if people need more information, they are linked back to the hotline. And after the counseling, the telecounseling at the hotline, they're also linked up to service providers. So that has been an experience that we've been having managing the hotline and the digital spaces that we run to ensure, number one, confidentiality, accurate and safe information, even just looking at the legal environment that we have on matters sexual and reproductive health. It's work in progress, but we have come a long way. And not to forget, we also have a specific website for the hotline. And I know Ruben will have that conversation a little bit later, just to see the interlinkage between the website and the hotline and even referrals. Thank you so much for sharing that. So what happens is when a young person has access to the Anti-Jane website, the website is so simple that when someone needs information on safe abortion, they just click the safe abortion area. If they need access to contraception, they just get information on contraception. These are some of the stories that have been shared by the community members or the people the hotline has already served. These are some of the stories that have been put in place in our website. And when we go back up there, we'll see where the website directly links someone. If someone needs to make a call, they do not need to dial the number. They just click the call for free because the hotline is free. So they just click call for free, and they're directly linked to the hotline. If someone needs a conversation for chat, they just click chat on WhatsApp and they're taken directly to the WhatsApp platform, which has a live counselor on standby to just respond to the questions and the inquiries made. And one thing, again, that I must also acknowledge is most young people, retention span is a little bit low, but when it comes to call, they love chatting so much. So the option of chat has made it easier for the young people to have conversations, even in their diversity. There are people who have hearing impairment. The chat option has given even the young people with hearing impairment, for the people who are not confident enough to have calls, a space where their confidentiality is assured, their safety is assured. Because another thing that we put in place is anonymity. One does not need to share their names. They can use pseudonyms if they want to. Their anonymity is so much assured and confidentiality is so much assured. So basically that has been the experience, and that still is the experience we are having managing the hotline as our digital health intervention and the digital spaces. Back to you, Ruben.
Thank you so much, Mickreen. Thank you for sharing all the work that you have been doing with Jane. It's very interesting and also very basically friendly, because yeah, that's it really achieved the goal of being friendly for everyone, especially for young people. So now let's pass to Nicolás. Nicolás, ¿puedes compartirnos un poco sobre cómo ha sido la experiencia en Fundación Unimedicos en Colombia con el uso de intervenciones de salud digital?
Claro que sí, y muchas gracias pues por el espacio, por invitarnos, Rubén, muchísimas gracias. Bueno, primero que todo, mi nombre es Nicolás Rodríguez Bohórquez, yo trabajo en Fundación Unimedicos, soy el coordinador de desarrollo institucional. Un poco de contexto de cómo se comporta Colombia. Aquí en Colombia tenemos un tabú muy grande en cuanto a todo este tema de salud sexual y salud reproductiva, aunque es algo muy común, pues no es algo que se hable de manera constante, ¿cierto? Entonces, todo este tema tecnológico nosotros lo comenzamos en aproximadamente 2007, 2008, creando primero que todo una página web informativa para que las personas pudieran encontrar información de nosotros, pero la verdad caímos en un primer error que fue tener una página con información robusta, con información muy dirigida hacia el personal médico, no hacia las personas del común. Con base a esto, Unimedicos ha tenido toda esta transformación digital encaminada a proporcionar información adecuada para la población común, para la población que no conoce los términos médicos, ¿cierto? Entonces, fuimos transformando todo esto de tal manera que la gente pudiera buscar de cualquier manera la información en Google y nos pudiera encontrar. Entonces, ese fue como el primer paso para nosotros, tener un buen posicionamiento en Google. Ya con el tiempo nos comenzamos a dar cuenta que la gente ya no estaba buscando tanto por Google, sino que ya dio este paso hacia las redes sociales. Entonces, aquí fue donde vino todo el cambio a las redes sociales. Primero comenzamos con Facebook, pasamos a TikTok, pasamos a Instagram, pasamos a Twitter, hoy en día pues X. Y en estas páginas fue donde nosotros comenzamos también a mostrar mucha publicidad. De hecho, hoy en día sabemos que la repercusión más grande la tienen más las redes sociales que las propias búsquedas por Google. ¿Por qué? Porque los jóvenes precisamente hoy en día tienden a buscar más información y a creer más lo que ven en redes sociales que lo que pueden llegar a encontrar en páginas web, ¿cierto? Al menos eso muy en el contexto latinoamericano. Entonces, ya con la llegada de la pandemia, nosotros comenzamos a explorar un poco todos los servicios de telemedicina. Comenzamos un poco con lo que fue la interrupción voluntaria del embarazo por medio de medicamentos. Ya habíamos tenido un acercamiento previo, pero a raíz de la cuarentena tan prolongada que tuvimos, pues buscamos estos nuevos servicios. Primero era una llamada telefónica, luego comenzamos a dar un poco más de información por medio de WhatsApp y pues ya todo converge al punto que hemos llegado hoy en día. ¿Y cuál es este punto al que llegamos hoy en día? Hoy en día nosotros contamos con una inteligencia artificial que está segmentada en tres partes. Una que es un assessment. Este assessment lo que hace es más que todo como un sí, ¿no? Pues voy a compartir en este momento un poquito mi pantalla para que puedan ver de lo que estoy hablando. Ahí ya se me está viendo, ¿cierto? Entonces, aquí pues no se ve esta primera parte, pero esta primera parte es básicamente preguntar si es una paciente que ya inició algún proceso con nosotros o si es primeriza. Uno elige la opción y pues ya aquí comienza todo un paso a paso. Primero le dice que quería hacerme una interrupción voluntaria del embarazo, confirma con un par de preguntas. Ya aquí ya pasa a una inteligencia artificial. La inteligencia artificial ya se encarga de, por ejemplo, tomar cuánto tiempo hay por fecha de última menstruación, si ya se hizo una prueba de embarazo, si no se hizo una prueba de embarazo. En caso que uno diga que no, pues recomienda directamente. Si hay una ecografía, uno puede enviarle la ecografía y la inteligencia artificial se encarga de de verificar la ecografía y confirmar cuál es el tiempo de gestación o confirmar si la ecografía es válida o no, siempre y cuando se tenga la parte escrita. Ya va para la parte de antecedentes médicos y si de pronto hay algo raro, pues inmediatamente hace una comunicación directa con un médico, pero en este caso ya se da un paso para que ya una persona sea la que se comunique. ¿Por qué una persona? ¿Y por qué ya se sale aquí de la inteligencia artificial? Porque lo que pasa es que se necesita ese contacto humano para poder terminar como de confirmar las cosas. Por más que la inteligencia artificial pues sea algo muy innovador en este momento, pues hay algunas cosas que aún requieren un poco de intervención humana. Aquí ya, como manera de consulta, pues, y para que ustedes vieran, quise hacerle un par de preguntas en cuanto a anticoncepción. Entonces, ¿cómo es un implante subdérmico? ¿Qué información me puede dar acerca del implante subdérmico? Acerca del DIU, siempre termina con un poco de información para confirmar que sea un médico quien pueda dar un poco más de información. Y ya aquí, por último, algo que es una consulta que es muy común que nos hacen a nosotros por medios telefónicos es qué hacer si se llega a romper un condón, si se llega a tener alguna clase de emergencia. Entonces, no entrar en pánico, considerar un anticonceptivo de emergencia, una prueba de embarazo, consultar con un profesional, inmediatamente se adjuntan las demás líneas que nosotros tenemos. Y esta ha sido como el punto de convergencia al que hemos llegado al día de hoy, ¿cierto? Antes de todo, también para resaltar una cosita extra, y es que en el momento en el que se construyó toda la inteligencia artificial, se le tuvo que dar mucho contexto acerca de cómo se comunican los jóvenes hoy en día, porque no es la misma manera en la que nosotros nos comunicamos, en los que, por ejemplo, una persona de 30 años se comunica como lo hace una persona de 15 años, al igual que no es la misma manera en la que se comunica una persona de 20 años. Entonces, todos estos fueron puntos que fueron fundamentales para darle a la inteligencia artificial y supiera cómo hay que responder, cómo hay que dar la información y cuál es la información que le pueden proporcionar. Eh, Ese ha sido como todo nuestro recorrido como en grandes aspectos.
Súper, muchísimas gracias, Nicolás, por compartirnos. Primero sobre cómo esta evolución que han tenido y que han vivido desde Fundación Unimedicos, que resuena mucho justo con la experiencia que hemos tenido, pues básicamente en todo el mundo, ¿no? En muchas ocasiones las personas piensan que la salud digital nació como una consecuencia o como una respuesta a la pandemia del COVID en 2020, cuando en realidad la salud digital es una realidad que ha ocurrido por básicamente casi que los últimos 20 años o un poco menos, y que en realidad muchas, sobre todo organizaciones de la sociedad civil, tienen muchos años de experiencia y aprendizaje, pues implementando estas intervenciones adaptadas a las demás actividades y estrategias que tienen y que han ido también evolucionando, así como ha ido evolucionando la propia tecnología, ¿no? Y que hoy en día ya vamos en la inteligencia artificial y que probablemente el día de mañana tengamos algunas otras innovaciones que nos permitan, pues bueno, seguir cumpliendo con nuestra promesa, ¿no? De que todas las personas tengan acceso a la salud sexual y reproductiva. Y un poco vinculado a eso, pues bueno, ya escuchamos cuál ha sido su experiencia y escuchamos como un poco también del éxito que ha tenido esta adaptación que han tenido también al contexto actual, pero nos gustaría escuchar también cuáles han sido los retos a los que se han enfrentado al momento de crear o implementar estas intervenciones de salud digital específicamente para las personas jóvenes.
Respondo yo primero.
Adelante, Nicolás.
Rubén, pues pienso que lo primero ha sido el tema de los ajustes, porque precisamente como lo comenté en un principio, nosotros las primeras fases de nuestras implementaciones en temas tecnológicos era información muy dirigida al personal médico. Entonces, fue como esa transformación al lenguaje juvenil, saber cómo los jóvenes se comunican, cómo hay que darle la información, que hay que tener en cuenta que pues si una persona, por ejemplo, de los 30 años está teniendo una emergencia en cuanto a anticoncepción, una persona que tiene 15 años pues va a tener muchísimas más preocupaciones que una persona que por ejemplo tiene 30, 40 años. Entonces, pienso que esa ha sido como la parte que fue más complicada para nosotros, como chocarnos con esto de frente y saber cómo hay que amoldar la información para poder proporcionarla y que la persona que está al otro lado de la pantalla nos pueda entender y que no quede como con dudas y que sienta que de verdad tuvo una muy buena atención de parte de nosotros.
Gracias, Nicolás. Mickreen, can you share with us how do you manage the challenges that comes in implementing digital health interventions for young people? What is your experience on that?
Thank you so much, Ruben. And just to add to what Nicolás has mentioned, some of the challenges that we have experienced, and I'm so glad that there's so much commonality between the work that we do and the work that Nicolás is doing, more so when it comes to ensuring access to self-managed abortion and access to pre and post-abortion care. That is so amazing. Great job, Nicolás. Now, back to the question on the challenges is one of the hugest challenges we've had to just ensuring that young people have access is censorship. Censorship goes back to the legal environment that we are in. Even when you're having conversations, and I think I alluded that during my intro in the first conversation, is talking about comprehensive sexuality education and providing information around safe and legal abortion is so much legally restricted. So the censorship has even made it very challenging to provide this information in a manner that young people understand without the algorithm just having us blacklisted and the content being pulled down. So it's one thing that we've really had a challenge. Another thing is on the bit of inclusion. And it's one thing that we are progressively working on, just making sure that the information provided is so inclusive, especially for the young people with disabilities, because when you look at the hotline, it definitely needs someone who does not have, for example, hearing impairment. When we look at the chatbot, sometimes there are people who have visual impairment, and we've had those conversations and the back and forth on how do we really improve in that. But thankfully, again, even with technological advancements, there are people who are visually impaired but can still have conversations on WhatsApp. So the bit of inclusion is something that we are really working on and trying to get the information translated, not only in a youth-friendly language, but in a disability-friendly language. And those are the things that have really come up. In terms of data cost, that is still on WhatsApp because the calls are for free. But thankfully, even when you're looking at the data charges in Kenya right now, it's quite affordable for most of the young people we are working with. So still the conversation on how to get WhatsApp to be really data friendly, especially in the hard to reach areas. It's definitely a conversation that that we are looking into. I'm not so sure if you asked of how we manage the challenges, or we were just speaking about the challenges, Ruben.
Sure, both, Mickreen.
Okay, thank you. So in terms of just managing these challenges, the way I've said is curating our messaging, both at the hotline and our digital spaces, in a very youth-friendly and inclusive language. I wish I'd shared that before so that you can see some of the content that we put out there on social media, because these trends keep on changing. And the way Nicolás said, a 15-year-old and a 20-year-old cannot really relate with the content a 30-year-old or a 40-year-old engages in. So curating the messaging in a very youth-friendly way, even if it means the use of slang. If that's the language that the young people are able to interact and understand better, we put the content outside there. And in terms of course, the data costs, waiving all the data on call for young people who cannot afford even to reach us on WhatsApp, because when someone sees our toll-free, they're like, is this number really foreign? But if they're not even able to reach us on WhatsApp or via text, we have an alternative where they can send something that is called a flashback, a please call me. You can call me back and we can have a conversation. So nothing will really hinder this young person from accessing information. And most importantly, even when providing information around complicated, not really complicated, but complex issues to do with safe abortion, the information has really been very well curated and very well packaged. And we walk through with the young person from access to pre-counseling information through the whole process, whether it's self-managed abortion at the hotline or if it's a referral. So there's that space where through the platforms we are able to walk through with the young person when it comes to accessing the services to completion. So those are some of the things that we have put in place and have really been helpful when it comes to managing the DHI challenges that we've had. Back to you, Ruben.
Muchas gracias, Mickreen. Sí, es bastante interesante escucharles, Mickreen y Nicolás, porque creo que quizás todas en algún momento, yo me resuena mucho que he estado como en ambos lados, ¿no? En el pasado siendo la persona joven que era la usuaria de estas intervenciones y ahora estando del otro lado donde me toca apoyar en el desarrollo de estas intervenciones, y es bastante complejo llegar a responder a esos retos, como ustedes lo mencionaban, ¿no? Tanto cuestiones como el lenguaje, por ejemplo, el poder conjuntar, por un lado, el responder a un lenguaje que sea amigable para las personas más jóvenes y que utilice el slang que las personas jóvenes están utilizando, y por el otro también que este mismo lenguaje entre en algunas ocasiones o se acomode también al contexto legal, especialmente cuando hablamos de salud sexual y reproductiva, que en muchos entornos es bastante restrictivo, pues se vuelve todo un reto muy difícil del cual lidiar, sin incluir todavía también todas las peculiaridades que tiene que haber en cuestiones de seguridad, en cuestiones de, como ya lo mencionaba Mickreen, que me encanta, que también tener una perspectiva interseccional que entienda que no solo las personas jóvenes son jóvenes, sino que también hay personas jóvenes indígenas, hay personas jóvenes con discapacidades, hay personas jóvenes parte de la comunidad LGBT, personas jóvenes que viven con VIH, y que eso implica también tomar un esfuerzo extra, ¿no? Que realmente entienda las realidades de estas poblaciones y que al mismo tiempo responda a las necesidades que tienen y no sea solamente algo desde la perspectiva de quien está proveyendo o desarrollando esta intervención, sino también de la perspectiva de quien, pues al final de cuentas, usará y se apoderará de estas intervenciones. Bueno, muchas gracias, Nicolás. Muchas gracias, Mickreen, por acompañarnos el día de hoy. Les agradecemos mucho todo el trabajo que hacen y agradecemos mucho también que, pues bueno, se hayan dado un poco el tiempo de acompañarnos en este webinario. Algo bastante interesante es que, como recordarán, Ivette les compartía sobre que este proyecto en el cual mapeamos intervenciones incluyó una serie de casos de estudio que contaba o que analizaba 5 experiencias de 5 países en donde organizaciones socias de Fòs Feminista, pues bueno, han implementado o trabajan implementando intervenciones de salud digital. Justamente Mickreen en TICAH y Nicolás en Fundación Unimedicos fueron 2 de esas experiencias, tanto en Kenia como en Colombia respectivamente, que participaron en estos casos de estudios y que nos ayudaron justamente, y por eso también me parece genial que hayamos hablado primero con ustedes antes de pasar a la siguiente parte, porque justamente todas las cosas relevantes que encontramos en la experiencia tan importante que tienen fue lo que nos apoyó a desarrollar una serie de recomendaciones, de las cuales ahora le voy a pasar la palabra a mi colega Ana de Darapov Alliance para que pueda compartirnos más sobre ellas. Adelante, Ana.
Muchas gracias, Ruben, and thank you so much also for Nicolás and Mickreen for the great discussion that we just had. So first of all, good morning or good afternoon, colleagues. My name is Anna. I'm the director of the Data Feminist program in Darapov Alliance. First, again, I would like to sincerely thank our colleagues from Fòs Feminista, from Darapov Alliance, and Mickreen and Nicolás for their insightful presentations. And for the rich and thought-provoking discussion we've had today on strengthening digital interventions with youth-friendly approaches. So as Ruben said, now I would like to draw your attention to a crucial and perhaps the most important part of today's webinar, the actionable recommendations that build on all the work, insights, and discussions shared so far. I would also like to emphasize that although I had the privilege of leading this project within Darapov, the results we are presenting today are the product of a collective effort. This work was made possible thanks to the dedication of many colleagues, including qualitative researchers, data analysts, and also data scientists, as well the close collaboration with our partners at Fòs Feminista and their network organizations. Today, we are not simply exchanging ideas, we are presenting practical, field-tested recommendations that emerged from real-world experiences across Fòs Feminista Alliance. These are not actually, Jenny, can you please go to the next slide? Thank you. So these are not theoretical frameworks, they come from lessons learned on the ground, from what worked, what needed adjustment, and what truly made difference in reaching and empowering young people. We have organized these recommendations around 3 key priority areas, previously explained by my colleague Ivette, which is digital maturity, intersectionality, and youth friendliness, each one rooted in tangible examples from real-life digital health interventions. That's what you'll find also in the report that will be published after this engaging webinar. As we walk through them together, I invite you to reflect on how these lessons could apply to your own context, your own challenges, and your own communities. Next slide, please. So our first pillar, or our first priority area, digital maturity, focuses on aligning digital solutions with real-world infrastructures and sustainability needs. So the first lesson and recommendation drawn from practice is understanding the digital ecosystem where you intend to implement your digital initiative. So before launching any digital health intervention, it is essential to deeply understand your audience's technological realities. A country or a region's digital ecosystem is shaped by a wide range of factors, so stakeholders, systems, cultures, social norms, political and economic conditions, and available technology infrastructure. So each of these can significantly impact a young person's ability to access and use digital tools. So conducting a comprehensive assessment of the digital ecosystem, ideally before launching a digital health intervention, can help determine if and how digital approaches can effectively engage youth. Importantly, because digital environments evolve quickly, this assessment should not be a one-time exercise, but revised regularly to inform improvements and adaptations. So, for example, we have seen that interventions targeting rural youth often failed when they skipped this step. Many assumed that smartphone ownership and internet access were widespread, only to realize that many young people relied on basic mobile phones and faced frequent connectivity issues. The assumption that an app would be easily accessible simply did not hold true. So on the positive side, other interventions acknowledged these gaps and early and took action. So some case studies showed that where digital access was limited, particularly in rural areas, organizations introduced structured digital literacy trainings, for example. One organization provided mothers with hands-on training on building digital skills and improving device usage. They also integrated a sensitization component into outreach efforts to address cultural taboos surrounding sexual and reproductive health topics, making digital engagement more approachable and accepted. So here the key takeaway is always start by mapping the audience's real-world digital landscape. Gather data, test your assumptions rigorously, and adapt your solutions to match user realities. A strong understanding of the ecosystem is foundational for building digital interventions that truly reach and empower young people. The second lesson emphasized the importance of adopting. Next slide, please, Tony. Yes, so the second lesson actually emphasizes the importance of adopting hybrid approaches, so combining both digital tools and traditional in-person services. So this is something that actually have been mentioned by the previous presenters. So not everything can or should be fully digital. During the design phase of any digital health intervention, it is crucial to evaluate whether a purely digital approach is appropriate for the context, and to carefully consider which channels and methods will truly serve the needs of young people. So while digital technologies have gained enormous attention for advancing sexual and reproductive health and rights services for the youth in recent years, evidence shows that blending them with offline approaches can also significantly improve service reach, accessibility, user safety, and also overall trust. In fact, case studies across low and middle income countries reveal that most effective interventions often combine digital platforms such as telemedicine, social media, and SMS with some form of in-person support. So for example, a medical abortion helpline introduced an optional in-person accompaniment protocol specifically for young users, while allowing older users to continue independently if they prefer to, so to not choose an in-person accompaniment. So this flexibility led to a significant increase in service uptake and user trust, as young people could choose to support the support model that best suited their needs and comfort levels. Therefore, blending digital and in-person touchpoints creates flexibility, and flexibility builds inclusiveness. Meeting youth where they are, both online and offline, is essential for expanding access and also strengthening trust. So the third lesson within the digital maturity priority area highlights that sustainability is not a nice to have. It must be built from the start. So financial sustainability means thinking beyond the initial launch costs. It requires planning for the long-term expenses of running a digital health intervention, including technology maintenance, operational support, and ongoing training for staff. Just as important, it involves developing a realistic funding model. So most case studies that we examined show that organizations heavily relied on donor-based models. However, many also faced uncertainty and instability once initial funding ended. So to overcome these, creative strategies are needed, such as building intersectional partnerships, exploring social enterprise models, or designing income-generating services. For example, some telehealth initiatives now offer paid online consultations at accessible prices, helping to support long-term operations without compromising affordability for young users. But financial planning alone isn't enough. A strong focus on monitoring, evaluation, and learning also enhances the sustainability of the intervention. So effective MLL systems track service delivery outcomes such as accessibility, usability, and user satisfaction, and measure how the key goals are being met, like safe contraceptive or abort counseling. They also create continuous feedback loops for improvement, ensuring that DHIs stay aligned with evolving user needs and changes in the digital landscape. For example, organizations that implemented SMS-based surveys and monitor social media feedback were able to make real-time adjustments to their platforms, strengthening their impact over time. Therefore, financial planning and monitoring, evaluation, and learning must be woven into the digital health intervention designed from day one, not treated as an afterthought. Sustainability, just like trust and accessibility, has to be built into the DNA of your intervention. So now, moving to our second priority area, intersectionality, we center the need for inclusivity and collaboration. So the fourth recommendation centers on leveraging intersectional approaches to integrate diverse perspectives and address the needs of different groups with target youth population across. Yes, thank you, Tony. Yes, perfect. Yeah, that's the fourth recommendation. So it centers on leveraging intersectional approaches to integrate diverse perspectives and address the needs of different groups within the target youth population across all stages of the digital health intervention. So planning, development, and implementation. So it's not enough to reach youth in general terms. We must intentionally seek and include marginalized subgroups. So our colleagues here today also mentioned some of the strategies that they have done to include those groups. Because a young person's experience with sexual and reproductive health is shaped by multiple dimensions of identity, such as gender, race, class, age, sexuality, geographic location, disability status, and migration or refugee background. But yet, intersectionality is often overlooked when designing digital health interventions. So applying intersectional lens means recognizing the structural inequalities that impact youth and then tailoring the strategies to meet the needs of those most often excluded. For example, if the goal is to reach urban adolescents, an intersectional approach would ensure that indigenous youth, youth with disabilities, and LGBTQI+ youth living in urban areas are explicitly included and served. Some examples of good intersectional practices include creating youth advisory boards that represent diverse groups within the community, targeting marginalized groups in outreach. So, for example, posting helpline information along migrant routes, using gender-inclusive language across platforms, offering services and digital content in indigenous language, adapting digital tools to be accessible for youth with disabilities, implementing digital literacy programs for rural youth or those with limited digital access. So here, the key takeaway is that inclusion begins with intentionally visibility. Who you include in your scope shapes who you will ultimately empower. The fifth recommendation then emphasizes that true inclusion happens faster and more deeply when driven by local expertise. So to truly apply an intersectional lens, it's essential to contextualize your approach, paying close attention to the historical, political, economic, and social factors that shape local power structures and inequalities. So integrating intersectionality into your digital health intervention requires conducting a social and political assessment of the specific vulnerabilities and dynamics affecting young people's sexual and reproductive health and rights experiences in your target context. So it's important to recognize that not every intersectional factors, such as the ones that I mentioned, gender, race, class, disability, will be equally relevant elsewhere. So tailoring your strategies based on a thoughtful assessment of local realities ensures your intervention addresses the most critical barriers and reach those most in need. One example is that one intervention with partner with disability rights organizations, leading to platform improvements such as adding voice command features and simplifying navigation, making the services more accessible for visually impaired users. So partnering with those who live the realities you are trying to address, create solutions that are practical, relevant, and effective. The sixth recommendation then stresses that intersectionality must also be embedded directly into your design, into the digital design choices, not just your outreach strategies. So digital health interventions use technology to close gaps in sexual and reproductive health services for youth. But the tools and platforms chosen must reflect the realities of the existing digital ecosystem. So we also mentioned that into the digital maturity priority area. So in doing so, new and ongoing digital health interventions don't just operate within that ecosystem. They actively contribute to strengthening it. So this recommendation specifically calls attention to how critical it is to embed an intersectional lens at every stage, when mapping the digital ecosystem, when deciding how to blend online and offline services, and when designing for long-term sustainability. So a strong example of how inclusive design can be is using encrypted messaging, pseudonyms, and strong gender-neutral language to create safe spaces where vulnerable youth could engage without fear. So therefore, inclusion isn't just about outreach. It's built into the very language, tools, and privacy protections your platform offers. And now we move finally to our third and perhaps most important pillar, the youth friendliness, reminds us that trust, relevance, and participation are non-negotiables when serving young people. So the seventh recommendation focuses on the critical importance of prioritizing privacy and digital security, which our colleague from TICAH actually mentioned as well. Social stigma surrounding sexual activity among youth can expose them to serious risks, including physical harm, emotional abuse, legal repercussions, and economic or social exclusion. Therefore, protecting the privacy, confidentiality, and anonymity of young users must be a cornerstone of any digital health intervention. The ultimate goal is not just compliance, it's preventing harm guided by strong ethical principles and creating a safe, trusted environment where youth feel secure accessing sexual and reproductive health services. So for example, some strategies that are important is allowing users to interact using pseudonyms, as I just mentioned, setting automatic timeframes for deleting sensitive information, limiting access to personal data to specifically authorized personnel. Data ownership also deserves careful attention here because organizations should avoid relying on third-party platforms such as Facebook or Meta or Instagram to deliver the services or collect personally identifiable information due to serious privacy risks. Katrina also mentioned that at the beginning of the webinar today. And finally, having a clear and transparent data management policy and communicating it openly to users is a powerful way to build trust and reinforce young users' sense of security. So one example, one helpline integrated automatic chat history deletion and allowed users to remain fully anonymous because these are key features that made it significantly safer for youth navigating stigmatization environments. So here the key takeaway is, if young people cannot trust your platform to protect them, they will not use it. So private security must come first. The eighth recommendation reminds us that the words you choose can either open doors or close them. So using youth-friendly language is essential for connecting with young users, increasing engagement, participation, and the overall effectiveness of digital health interventions and sexual and reproductive health services. So defining youth-friendly language can be challenged because it must adapt to the digital health interventions specific context. However, there are a few key principles to guide us. So first, the language used should be clear, direct, and approachable. So avoid using technical jargon and complex terminology. For example, using the word abortion is far more effective than saying voluntary interruption of pregnancy. Second, it must be inclusive, non-discriminatory, and accessible. This means adopting gender-neutral language, ensuring accessibility features for users with disabilities, and considering cultural and linguistic diversity. So, for instance, content aimed at young Indigenous girls should be available in their native languages. And finally, language must be free of judgment, especially around sensitive sexual and reproductive health topics. Okay, so I'm gonna rush a little bit. So here the key takeaway is clear, inclusive, and non-judgmental language is critical foundation for building trust, encourage access, and strengthening the impact of digital health interventions. And the final recommendation is that youth must be co-creators and not passive recipients. So creating spaces for meaningful youth engagement through participatory approaches brings great benefit to digital health interventions. So at every stage of the digital health intervention, from design to implementation, involving young people can transform the intervention into something that is more relevant, inclusive, and effective, while also empowering youth by addressing their diverse needs directly. So here the key takeaway is when young people help shape the process, the outcome is stronger and it becomes more authentic, more usable, and also more trusted. And to very quickly wrap up, because I know I'm out of time, these 9 recommendations that I just mentioned, they are not just checklists. They are actually calls to a call to action rooted in real-world successes, and they challenge us to think critically about how we design, fund, measure, and implement digital health interventions that truly serve the sexual and reproductive health and rights of young people. So remember, youth participation, intersectionality, and digital maturity are not optionals. They are an essential for lasting impact. So thank you very much, and back to Fòs Feminista colleagues.
Thank you so much, Anna. And so sorry for the rush at the end. So we are almost on time, but we don't want to lose the opportunity to actually have a round of questions and answers with our panelists. So please, everyone who has any question or any comment, you can add on the chat. I remember we have one specific question, and I think this is for Mickreen and also for Nicolás about, is it expensive to implement a digital health intervention?
Bueno, sí, vi la pregunta en cuanto al tema del costo de mantener una inteligencia artificial, realmente no lo es. No es tan costoso como uno lo piensa. Hay que verificar según cuáles son las necesidades que se están teniendo, cuáles son las tecnologías que hay que implementar, pero realmente no es tan costoso como se piensa.
Gracias, Nicolás. Mickreen, do you want to add something?
Yeah, in terms of setting up a hotline, it goes both ways. For something as simple as just having mobile phones and the handsets, that is not costly at all. But setting up a robust system for a toll-free center, that is costly. Materials, installation, and management, that is quite costly.
Perfect. Thank you, Mickreen. And yes, I totally agree. I think sometimes the development will, depending on the technology you said, the development will not be necessarily like very expensive, but actually the maintenance of this intervention and also to having a proper team with proper people and specialists will be maybe the difficult part of managing digital health interventions sometimes. So I don't know if we have any other question. Okay, we have been also responding to some of the questions in the chat before. Okay, so I guess then we're going to pass to the wrap up of the webinar. So now I'm going to welcome my colleague Susana Medina, who will be delivering the closing remarks for this space. So hand over to you, Susana.
Gracias, Rubén. Bueno, ha sido un gusto ser parte de esta sesión. Me presento, mi nombre es Susana Medina, yo trabajo en Fòs Feminista como líder de implementación de programas y en este equipo hemos tenido el placer y el gusto de colaborar con Data Pop Alliance para la realización de este estudio. Ha sido un trabajo de gran calidad, profesional, ha sido riguroso y definitivamente los resultados y las recomendaciones, además accionables, se convierten en grandes herramientas para el trabajo con organizaciones como por ejemplo la Fundación Unimedicos en Colombia y TICAH en Kenia. Gracias Nicolás y Mickreen por contarnos sus experiencias concretas en desarrollar estas estrategias y además en cómo adaptarlas a las poblaciones y a las comunidades concretamente para las que sirven. Y en este sentido, como Fòs Feminista, el trabajo en intervenciones digitales es parte de nuestras estrategias principales. Como una de nuestros grandes compromisos está expandir el acceso a las comunidades sistemáticamente excluidas. Y aquí es cuando las intervenciones digitales son recursos complementarios para poner a estas poblaciones y a estas comunidades en el centro de la atención, de una atención sistémica, porque toma en cuenta todos los recursos con los que las personas excluidas, las comunidades marginadas pueden contar para efectivamente resolver sus necesidades. Y como alianza, Fòs Feminista tiene la interseccionalidad como parte de nuestro corazón del trabajo y las organizaciones con las que trabajamos y nos asociamos son justamente lideradas por las comunidades en mayor situación de vulnerabilidad. De manera que tener estos hallazgos de este estudio permiten efectivamente potenciar nuestra misión de expandir el acceso y a la vez permiten asegurar que estas intervenciones se articulan al ya existente, muchas veces débil, sistema de salud. Entonces es una forma también de reforzar una respuesta sistémica a la salud de las personas. En este caso, también hay un elemento central que estamos hablando de intervenciones basadas en evidencia. Ustedes nos han contado cómo efectivamente esto fue desarrollado y fue teniendo iteraciones. Y es hoy, además, un producto en evolución, un producto que probablemente en pocos meses cada vez va incorporando más aprendizajes. Entonces, en ese sentido, creo que justamente esta conversación aporta mucho a poder cerrar esa brecha de conocimiento que teníamos y poder además contribuir a que esto sirva para todas las organizaciones socias con las que trabajamos, ya que el aprendizaje y el intercambio de conocimientos también es parte de nuestro ADN como alianza. Y aquí quiero destacar, cerrando este webinar, dos elementos centrales. Uno es cuando los desarrollos digitales colocan a las comunidades en el centro y conocen sus necesidades, las formas de acceso a entornos digitales, responden efectivamente a esas necesidades que son simples, esos matices de las necesidades que pueden ser invisibles para modelos estandarizados, pero que hace y que marca la diferencia de modelos de intervención en salud basados en los derechos humanos. Es decir, cuando reconocemos asuntos de dignidad, de privacidad, consideraciones éticas, pero además integrando las necesidades de las personas que son consecuencia de factores estructurales de exclusión y de opresión. Entonces, hay una consideración de la salud como derecho humano y de las respuestas inclusivas y efectivas para estas personas como un elemento central. Entonces, eso creo que es fundamental. Y el otro elemento clave es desmitificar las intervenciones digitales, y en este caso el equipo de Fòs Feminista, en la introducción de Katrina también pudimos ver esto. Las mejores intervenciones digitales son además aquellas que le funcionan a las personas en cuestión, y en este caso a las personas jóvenes, y no se requieren grandes desarrollos. Y en esta última fase de la sesión, tanto Mickreen como Nicolás respondieron, tampoco se requieren grandes inversiones de dinero, son soluciones que pueden ser de base comunitaria, porque son soluciones que, como ustedes bien han contado, han escuchado cuáles son las barreras, han escuchado cuáles son los recursos. Entonces, conjugar estos elementos, además de generar implementaciones mucho más costo efectivas e inclusivas, también, bueno, responden a grandes desafíos que fueron elevados en esta conversación, como la sostenibilidad, cómo hacemos para que una respuesta digital además sea continua en el tiempo y pueda mantener la continuidad que muchas veces los sistemas de salud en persona no ofrecen a las comunidades. Entonces, bueno, para cerrar, retomo aquí los principios básicos de poner las necesidades de las comunidades al centro de los desarrollos. Creo que es fundamental entender que el éxito está en desarrollar las intervenciones con las comunidades, las personas jóvenes, y a la vez para servir a esas mismas comunidades. Entonces, mantener este diálogo y este debate continuo para asegurar la inclusión desde, como dijo Ana, todas las fases de los desarrollos. Me gustó mucho escuchar a Data Pop Alliance contando también su historia de cómo nace esta colaboración, porque también esta experiencia nos demuestra una vez más que pensar juntos, traer experiencias y debatirlas, elevar las voces de campo que están al primer nivel de las respuestas, es fundamental también para poder desarrollar una comprensión exitosa de qué es lo que funciona. Y también quiero destacar de la intervención de Mickreen justamente cómo conocer también los entornos legales y entender cómo conjugar las respuestas a las necesidades de las personas jóvenes en estos entornos legales es determinante, porque es parte además de la seguridad y de la calidad del servicio que se ofrece. Y en el caso de la Fundación Unimedicos, entender que el desarrollo de estas respuestas también están vinculados con la evolución de las organizaciones. Entonces, como Unimédico nos contaba, iniciarse con servicios de información, a pasar por la telemedicina, por la inteligencia artificial, porque estamos todas las organizaciones evolucionando como las tecnologías. Entonces, creo que eso ha sido súper importante. Y bueno, cierro mi intervención una vez más felicitando a todas las personas que colaboraron en este equipo: Ruben Avila, Katrina Wicks desde Fòs Feminista, todo el equipo de Data Pop Alliance, TICAH, Fundación Unimedicos y las otras organizaciones que fueron parte de los estudios de caso. Muchas gracias por abrir este debate, por continuar además generando productos que realmente sean transformadores y vitales para el fortalecimiento de ecosistemas que son quienes están dando la respuesta a las comunidades más excluidas. Y felicidades por este webinario y muchas gracias.
Thank you, Susana. Thank you, everyone. We hope this webinar has been fruitful for you. We will be sharing the recommendations report after the webinar by email and also in social media. And please, let's keep the conversation about digital health interventions for young people. Thank you, everyone. Have a good day. Thank you, Data Pop Alliance, Mickreen, Nicolás, Fòs Feminista team, and the interpreters.
Thank you.
Thank you.
Bye-bye.
Thank you very much.
Muchísimas gracias por la invitación.